Today I'm very pleased to introduce you to Quentin Durand-Moreau, who is going to speak to us on the topic of a double transition, reactivating the Occupational Medicine Residency Program in pandemic times. Quentin is an assistant professor and Occupational Medicine Residency Program Director in the Division of Preventative Medicine in the Department of Medicine at the Faculty of Medicine and Dentistry. Please join me in using your reaction buttons and welcoming Quentin to our session. Quentin, thank you for joining us. You may begin.
Thank you very much, Cosette, for your nice introduction, and thank you for allowing me to participate in the Festival of Teaching and Learning this year. So as Cosette said, my presentation is entitled A Double Transition, Reactivating the Occupational Medicine Residency Program in Pandemic Times. So I'd like to start with a couple of disclosures, and the relevant disclosures for this talk are pertaining to the grants I do have as a PI. I do have a grant from the Alberta Medical Association section of Occupational Medicine to develop educational resources in occupational medicine and Indigenous people. And I'm a co-investigator for a grant from WCB Alberta that is funding some educational initiatives in our program. So my voice is not the voice of any of those institutions. So first of all, before I move forward with my presentation, I may need to clarify what occupational medicine is, because not everyone knows about it. And most people may confuse us with occupational therapy. So occupational therapy is a field of rehabilitation medicine. So they are rehabilitation specialists. Occupational medicine specialists are physicians. And as such, our field of interest is basically anything between work and health. And our activity is mostly split into two parts. The first one would be anything about fitness for work. So in practice, it would be discussing what we call the limitations, the restrictions, the modified duties, and things like that. The second part of our work is about work-relatedness. So helping patients understand whether or not the conditions they may have is or not related to their occupational history. So let's say a cancer may be related to asbestos exposure, for instance. So we are going to discuss with the patient, get evidence to make the links between those two elements and support the patient go for a WCB claim, for instance. So at the UofA, we do have a residency program in occupational medicine. So this is what we call a medical subspecialty. This is a 2-year training, and this is additional training for residents that already completed a specialty residency. So we get experienced residents that have either completed an internal medicine residency program of 3 years or a public health and preventive medicine residency program of 5 years. And after that, they enter our 2-year residency training. Our residency program is accredited by the Royal College of Physicians and Surgeons of Canada, which is the national institution that is providing the standards to which we have to comply with, and to make sure that we deliver the teaching that is required for the residents to get certified by the Royal College. So the questions I'm going to deal with during this presentation is basically how we have created learning experiences that build connections and allow for collaborations with two challenges. First, the pre-existing challenges we did have in our program before the pandemic, and that would have stayed no matter the pandemic situation, and the additional burden of the pandemic challenges. So basically how we've been able to deal with this, take opportunities to develop our program, and where the further development are for us. So let's get started with the pre-existing challenges. So our program is what we call a recruiting program. A residency program can be separated in two categories: the selecting programs and the recruiting programs. Selecting programs are those who have much more applicants than spots that are available. So they are very popular. And programs have the luxury of being able to pick and choose the best residents, and they are practically sure to still have residents year after year. This is not the case for occupational medicine. We are not as popular as some other programs. We are recruiting. This is not a problem specific to our university. It is not even a problem specific to Canada. This is a worldwide problem. Any program in occupational medicine in any country faces challenges in terms of recruiting and attracting residents in our program for many reasons. The field is original. It's less connected to the vision people have when they get started in medical school. These are a couple of reasons. Another challenge was that during the academic year 2019 and 2020, we were inactive, meaning we did not have any in-house resident, enrolled in our program during this academic year. So this is a challenge because it means that a lot of educational initiatives are paused during this period. And the problem is that we need to keep people engaged, motivated, and willing to deliver the teaching and expand the program. So when you are in need for recruiting residents, and having an inactive program is an additional barrier, an additional hurdle to make sure that you are going to use all of the resources you need to attract the residents in the program. We are also a small program. We have only 2 spots per year for a 2-year program, which means that our maximum capacity would be a maximum of 4 residents at a given time. I guess in the history of the program, we never reached this maximum capacity. Currently, we do have a resident, and as of July of 2021, so in 2 weeks from now, we are going to get a second resident. So we are going to be at 50% of our maximal capacity, and I'm really pleased to have 2 residents in our program. We also have the opportunity to get residents from other programs, mostly public health and preventive medicine, internal medicine, dermatology, to name a few. Those residents come for just 1 block, 1 month of training, to get to know our specialty, to get some knowledge, but they are not aiming at that step to become occupational medicine specialists. So it helped us to keep somehow active and to keep connected with other programs, and also to have a way to attract residents that may be interested with our program in our subspecialty program. Another challenge is that we are due for an external review with the Royal College with a couple of points that we needed to correct it. So we had to work quite hard on that. And I'm pleased to say that we're on track to be ready for this external review that is scheduled in September of this year. And the last challenge for the program is basically myself as a new program director that has started in July of 2019, coming from a country where no such thing as accreditation exists. So I needed to get all of this knowledge and to benefit from all of the internal training and resources from the Royal College. So it was quite of a transition for me, quite of a significant, step to climb to be able to do the job. But so far now, I'm starting to feel a little bit more comfortable after 2 years of working as a program director. So with the pandemic, we are experiencing challenges that are much more common to any residency program and more of any program, even outside of medicine at the university. Of course, our in-person teaching experiences have been significantly reduced with the opportunity to have gatherings and in-person teaching experiences. However, we can't complain too much because as we are in medicine and as a postgraduate program, we still had the opportunity to keep in-person clinical experiences at some point, even though a significant portion of our clinical activity has moved to virtual teaching, virtual clinical activity. Another challenge is that as we got a new resident in July of 2020, during the pandemic, coming from another university, I was a little bit concerned about this resident not being so secluded, so lonely, and to also have opportunity for him to get connected. So we tried to introduce our resident to his colleagues from other programs. And finally, one of the last challenges related to the pandemic is that most of the industries have closed the doors for visits and on-site tours. And the thing is that as we are a recruiting program, we also need to develop initiatives to attract people in the program that maybe some other programs don't even need to consider. So we were organizing industry tours. So we've been doing one before the pandemic at the Waste Management Center to review the occupational hazards in this place. But all of this has been paused because of the pandemic. So we're really hopeful that such initiatives that may be interesting for students and residents, that this initiative may be reactivated after the pandemic. So basically what we've been doing, there are 3 programs in Canada, and we are connected together. So during the pandemic, we strengthened our collaboration with the University of Toronto and the Université de Montréal. We strengthened and we formalized a national occupational medicine program directors working group. We used to have an existing cooperation in the past for the academic teaching called academic half days, but it was a telephone conference with the residents receiving a deck of PDF slides and moving those slides individually on their own computer. It was a little bit old-fashioned, we were thinking, and the pandemic was the perfect opportunity to do as most people have been doing, moving through a Zoom environment that was a little bit more easy for the residents and a little bit more user-friendly. We've been reviewing our academic half-day curriculum during the time of our inactivity. So we enjoyed this time of having no resident to work on the structure of the program and build up a 2-year national academic half-day curriculum with teaching blocks and self-directed learning time protected to help the residents have time to work on e-learning modules required in our program. Our teaching material is shared through a Google Drive accessible to residents and program directors. And as of this year, we started to deliver a mock exam through Google Forms. So all of this were experiences that were totally compatible with the pandemic reality. So all of this has some positive sides. We already had kind of a collaboration between program director, but the pandemic world has allowed us to strengthen our relation, to formalize national program directors meeting, and to build up and have a more built and a little bit more structured curriculum for the academic half days. This connections also allows us to increase the critical mass of participants, because when you do have one resident, it makes the situation challenging for interactivity, building network, asking questions. It's a little bit more difficult. So sharing all residents and program directors who are all attending all of the sessions as facilitator, all of this allows to stimulate questions and interactivity. It also allows us to have an homogeneous training quality all across Canada and meeting high standards because we try to select the best speakers on each of the topics. Our organization allows us to adjust if we have cancellations, and we are also having some attraction from the elective residents attending those sessions. I'm going to end my presentation with mentioning a couple of challenges and upcoming work. First of all, I see, as I'm reporting this, that we are not yet a very fancy program with a lot of, innovative teaching experiences and simulations. You see here a Christmas tree, and I see that at that step we are more working on the tree, on having the tree rather than the ornaments. And I do feel, I'm not sure that this is evidence-based, but that most of the discussion and most of the resources that are easily accessible are most on the ornaments, most on the innovative teaching, and it may be a little bit more a struggle to find easy resources to help you do the structure, to help you build your Christmas tree. I'm not sure I'm right with this, but this may be something we may discuss. As we are shared with different universities, and as Canada is quite a large country, we may experience a little bit of time zone issue, but this is not too much of a problem. We can adjust this, but it allows us, it requires us to shorten the academic half-day sessions. We also had some issues with the tools. The UofA has incredible tools, such as eClass, but the thing is that it may be challenging to open up those tools for people outside of the university. And I have to confess, I have to admit that I struggle a little bit with eClass, and I find that it requires a lot of time and investment to get the output of it. It's difficult to collect anonymous feedback when you have just one resident. And the thing is that people cannot report in confidence the genuine feedback when there is just one form. So attending the sessions for us as program director is also a way to see whether the nonverbal cues from the residents are positive, whether they are participating, and whether the speakers are good enough for the program. Having few residents is also challenging to have them engaged and be on all topics, being on the leadership positions they need to take, to propose some teaching topics, to run journal clubs. They can't possibly do everything. So it's also kind of a hurdle compared to bigger program where all of these initiatives can be split on different groups of residents. Our upcoming work is, of course, the external review, the transition to competence-based design with the challenge of clarifying our objectives of training. And I'm going to start working on that with our national group of program director this summer to get ready for the transition to CPD. And at some point to work on our Christmas ornaments. We will need those as well. So now I'm going to stop my presentation and open up for discussion and also suggestion, because I have to admit that I'm hopeful that the discussion we may have would be a way for me to get ideas, your input, and some excellent suggestion for our program. I'd like to thank you for listening to my presentation.